So this is how the enrollment process would work. And as I said before, when we add a family or a group, we can add a single person family if the insurance scheme is for single one person, or we can define multiple people into a family and then have an insurance policy that relates to them. And then the next process that we would go through after enrollment is claim submissions and review. So claim submission and review happens at two different places. Claim submission happens at the provider part. So this is the health facility. After they have provided services to the patient, then they submit a claim to be reimbursed by the payer. And then the claim review happens at the payer end, where they receive the claim submitted from providers, they review it, and then provide payment based on this review. So again, I would go back to the demo version to show you how this is done. So as an example, let's take an example of a health facility entering in a claim. We would go into claims, health facility claims. And since I'm logged in as admin, I have to fill in an extra few points here. But if you were just logged in as a person from a health facility, all of these would be filled out automatically. So just information about the health facility. And then so once these are all filled out, then we go into the process of adding a claim. So once we click add here, we'll get a screen that looks a little bit complicated, but it has all the information. It has ways to capture all the information that we need for claim to be complete. So on the top left here, we enter in the insurance number of the patient. So obviously that has been kept by the health facility. The patient name and all of the other information related to the patient will show up once the insurance number has been provided. On the top right, we have the visit date from and to. So this is the information that is required to say, when did this particular patient visit this health facility? So when did they arrive? When did they leave? And again, there are other dates. So a little bit to the left, the date claimed. So this is on the live version, this appears automatically. So this would be the date the health facility is claiming. A claim number is a unique number per each claim. So this can be created by a health facility or pre-populated or provided in advance from the payer. And then to the left of that is where the ICD-10 diagnoses codes are to be entered. So all the ICD-10 codes are listed here, and health facilities can select what the main diagnosis was, and then secondary, and then tertiary, and then even up to four more diagnoses ICD-10 coded if required. And then they would enter in what visit type it was. Was it an emergency or referral? And these particularly the visit type also has implications in terms of how claims are adjudicated. Below that is where now services would be entered. So this is where, as you remember from before, when in the administration tab, all the medical services and items that the medical services particularly that are available in the scheme would be listed here. And whenever, so whatever service was provided can be clicked. The quantity appears as 1 as default, and the pre-agreed pricing. So either from the price list or the defined or the default pricing, the price appears here. The health facility can go on adding the different services that were provided if there were more services, and then they do the same with items. So then they enter in items as whatever was provided. So if some drugs were provided, You click on the item code, you enter in the quantity, the pre-agreed pricing per unit appears here. And then if you look at the top right-hand corner, the claimed amount is the total of the services and the items, including the multiplication for the quantities. So once this is filled out, a full claim has been entered, and this can be submitted. So first saving and then submitted for review to the health institution, to the payer, sorry, from the health institution to the health insurance scheme or the payer. So this is how it would be done. So I wouldn't go through the process of all clicking save and submit because that would take some time. But then the last function that I would briefly go through is having a claim being reviewed. The information, so this is all the information a claim would contain, and this information will be available for the payer to review from the claims and from the claims menu by clicking on the review option. So this is where everyone, the payers, the medical review team, or whatever kind of team is available at the payer at the health insurance office would be able to select various claims that they want to look at, and then they can either approve or disapprove claims, or partially approve or disapprove claims as well. Um, so as I just entered in some information that they could use to actually select claims. But since the list is quite long, we have a large data set. I'm just trying to see if we can find a few claims that can be shown here. So this is how you see this list of claims over here. This is how a claim reviewer would see. They would see each and every claim, when it was claimed, what is the claim number, the health facility, and these are claims that I'm showing that have already been adjudicated upon. So some have been rejected, some have been checked and passed on, and some of them will also be evaluated. But the claim reviewer can click on each of these claims and then click on the review button and actually see the details of the claim. So here we're having, because this is not a live system, we are having some issues showing all the services that were claimed and items. But generally, if you look on top, this is all the information of the patient and the diagnoses and the date claimed and all the different information. What you would see here are the services that would have been listed and the items. But because of the data set that we have, not all of it is visible right now. We're working to fix this as soon as possible. But then each reviewer would have an option of accepting or rejecting every claim from here. So this is how a health insurance provider would look through each and every claim, and they can select some as a sample, as a random sample. So as you can see here on this screen in the very middle part, you can select a number of claims for review on a random basis, so as a certain percentage, or as below or above a certain value from here, and then a certain percentage of variance from the fixed pricing that has been agreed on. So all these options are available, and the claims can be evaluated on batches once the reviews have been done. This is where OpenIMIS process-wise stops. After this, the review status of claims, we have other reports from here focusing on enrollment status and everything. But otherwise, these are all the functionalities, major functionalities of OpenIMIS. And this is where I would like to stop for now. And if there are other questions, please reach out through the wiki or email, and we can discuss them further. Thank you.
Thank you. So, Rob, thank you for that quick demo. I know that there are more features, but we have to keep our time. So let me go through the rest of my slides. So now that you've seen the basic features of OpenIMIS, um, allow me now to show you some next steps that we plan to do. So for 2019, AeHIN hopes to develop communities of practice in interested countries. And so far, we've had expressions from Thailand, Philippines, and Indonesia. And I hope that after this call, we would be receiving expressions of interest from some of you as well. We wish to nurture these communities of practice and allow them to think of ways they can strengthen universal health coverage concepts, open source software concepts, health education and collaboration using the OpenIMIS software, and provide them with external experts as resources, provide them with a webinar platform for better collaboration within their country, provide them with an online training platform, and provide them with OpenIMIS on the cloud. So each of these countries will have their own OpenIMIS versions on the cloud that they can now configure. You saw the Nepalese version, and those would have the geographic units in Nepal. But if you are a participating country, then we would put in the geographic codes for your country in your own country OpenIMIS. That would be at the country level. So there would be activities in Thailand, activities in the Philippines, and activities in Indonesia. But once a month, at the minimum, or more frequently as needed, we would be interconnecting this country communities of practices into a larger regional COP through teleconferences and sometimes in face-to-face meetings. And finally, we wish to connect the regional AeHIN community of practice to the larger global community. So specifically for Philippines, we wish to identify interested medical and nursing schools uh, with the focal point of a faculty member, and we would be using the current OpenIMIS manual of operations and extend that for use in their clinical skills lab. Most medical and nursing schools already have their clinical skills lab where they perform services to the mannequins, and these services to the mannequins are actually reported in a piece of paper which they submit to their instructor for monitoring what skills or procedures they've been able to do. So we think that we can use OpenIMIS very simply as a way to report services that have been rendered to the patients, and also as a way for very simple documentation of services rendered to the patient. For this, we would be providing OpenIMIS on the cloud to these schools and train their faculty and selected students on how to use OpenIMIS for that very, very simple clinical skills lab setting, which is recording or documenting a specific service provided to the mannequin. The mannequin here, in this case, would be named according to the name of the student, and the student can now use OpenIMIS as a way to track what procedures have been performed. The faculty member in the skills lab will then serve to be the OpenIMIS administrator, and they would be able to accept and reject the services or the procedures performed by the students. Now, in some cases, and we'd like to encourage some of the schools who are participating, they might want to implement OpenIMIS beyond just the clinical skills lab, but also use it as a way to start their own internal insurance system. I know that there are some medical schools already that are running a internal school-based insurance system, so they can use OpenIMIS to monitor the contributions and also monitor the benefits provided to the student members of that internal insurance system. For the Philippines, our focal point is Christine, who is our secretariat in AeHIN, and myself. But we are now contacting faculty members from the University of the Philippines and St. Luke's College of Medicine, and we hope that at least 2 medical schools will be participating in this project. For contact, you can send an email to secretariat@aehin.net.